Do you have pelvic organ prolapse and you don't want surgery? Have you considered a pessary? Maybe you've never heard of a pessary, or maybe you've tried one and you'd like to know how to make it work better for you. I'm the Kegel Queen. I'm a registered nurse and my name is Alice Adams. And in this video, we'll talk about how a pessary can help you care for pelvic organ prolapse, a cystocele or prolapsed bladder, rectocele or prolapsed rectum, or prolapsed uterus. So what is a pessary? I have some samples here to show you. Pessary is basically a silicone thing. They come in all different shapes, and I'll show you some. But it's basically a silicone thing. They're not all discs, but it sits at the top of your vagina, kind of like where a contraceptive diaphragm would go, up at the top, and holds prolapsed organs in place. So let me show you some other ones. And again, they come in all different shapes and sizes too. So this one is a largish. There are bigger ones. This is a ring pessary with support. This is the ring, there's the support. This one is much smaller. This style of pessary is called a Schatz pessary. See, it's like a kind of like a little frisbee with holes, and you can see it's thicker. This is a cube pessary. Goes in this way. This is a little thing that helps you take it out. There's the cube, and this one is called a Gellhorn, and so the top of it is kind of like this one, but then it's got this part that sticks out. And there are many, many other styles of pessaries. These are just a few examples, but there are different ones that are good for all different kinds of things that might be going on in there. There are ones that are good for multiple types of prolapse, ones that are good for helping with incontinence, the ones that are good for incontinence and prolapse, all different ones. And more importantly, the different shapes of pessaries are good for different women. You could have two women with exactly the same diagnosis who need completely different pessaries to fit properly and work well for them. So let's talk about advantages of a pessary. Number one, they're safe. There's not a whole lot that can go wrong with them. The list is short of things that can go wrong with pessaries, especially if you take care of them properly. You can end up with some abrasion. They can irritate the vaginal lining. You can end up with a little bit of tissue damage and bleeding. If you're caring for it well and receiving good medical care, that shouldn't become a big issue. There's other stuff that can happen if you're not caring for it well and not receiving good care. We're not even going to go there in this video because I'm assuming that you're going to take good care of your pessary and that you're going to make sure you're working with a healthcare provider who is also committed to really, really good care for you. So when you're taking good care of your pessary, not a whole lot can go wrong. It is also reversible. If something does go wrong, I had one woman in my program who had an allergic reaction. Most people don't. This is medical grade silicone. They're very inert. There's not a lot of stuff that's going to leach out of there or interact with your tissues, but one in however many women is super, super rare. I did hear from a woman who had like a rash from it. She just wasn't a candidate. She couldn't use one. If you get something like that, or you get an abrasions or something, you have a problem with the pessary, you just take it out. It's fully reversible. Unlike, for example, surgery, which is forever. A pessary just comes out. Another great thing about pessaries is that when they're fitted properly and they're working well, you can feel relief right away. It's as if the prolapse isn't there anymore. The sagging feelings of prolapse, the discomfort can just go away right away. And that's pretty miraculous if you've been suffering with prolapse. To work properly, you need a couple things in place. You need the pessary to be fitted correctly, for one thing, and that means that you need the right style for you. All these different shapes and many others to choose from. You need the right style, and you need the right size. There are many different sizes, so to find exactly the right one and the right size and style for you can be a bit of a project. It's not unusual to need to try several different ones before you find the one that's right for you. And it can be kind of a problem sometimes for women if you're working with a healthcare provider who doesn't have the level of commitment needed to make sure you get fitted properly. Unfortunately, healthcare providers don't get paid a lot for doing pessary care. Some of them don't really put a lot of time and effort in because it just doesn't work in their practice. But if you have a healthcare provider who's willing to work with you and keep trying, you can find one that's right for you. Another thing that has a huge impact on how well a pessary works for you is your pelvic floor. So let's take a look at our pelvic floor for a second. This is your pelvis. This bowl of muscle is the pelvic floor. You can see the pelvic floor, see the shape of it. It's this bowl, and that helps support your pelvic organs. Now, it also helps you keep a pessary in place. If your pelvic floor doesn't have enough tone, if it's too slack, or if your pelvic floor doesn't have enough mass, meaning is it thick and toned, the pessary doesn't have the support that it needs to stay in place properly. So that's where Kegel exercises come in. Now, in order to build mass and tone in your pelvic floor, you need to do Kegel exercises in a very specific way to get the therapeutic benefits. You can't just do Kegels the way you read about them in a magazine with one sentence or two of instructions. You need really good instructions with real detail about how to do Kegels correctly. But if you do Kegels correctly, you can build the mass and tone in your pelvic floor so that it can really help support a pessary properly. And many women in my Kegel program who've learned how to do Kegels correctly have had the experience of my pessary doesn't really stay in, my pessary is uncomfortable, it doesn't fit quite right. And then after building the pelvic floor with exercising correctly, with correct Kegel exercise technique, then the pessary works much, much, much better. So Kegel exercises can really help your pessary work the way it should. To find out more, please visit kegelqueen.com. I'm the Kegel Queen, and I'm here to help.